acute trauma for any of us. The patient experienced a severe disruption to their cognitive baseline. Now, anxiety and clinical depression are the most common outputs. This trauma is compounded by internalizing that stigma. Now, when the mind is under attack, the immune system is compromised. I want to pause there to make sure you heard that. Now, let's think. How does this psychological state directly impact their clinical outcomes? Or let's change that. How does that psychological state directly impact your critical outcome? It creates a direct, measurable barrier to medication adherence. Now, if a patient is severely depressed, executing executive functions such as just taking a daily pill, managing insurance paperwork, or attending medical appointments, it becomes nearly impossible. Now, the virus exploits this cognitive paralyzation. Think of it that way. We see direct correlation between untreated depression and high viral loads. You cannot expect a patient to fight for their physical health if they do not possess the mental capacity to fight for their tomorrow. I want to think about it as it is an escalating failure. The mental health crisis accelerates the biological crisis, right? Do you understand what I just said? The standard medical model often ignores this. A doctor will write a prescription for an antiviral and assumes the job is complete. It's done. You've gone to the doctor, they've given you your medication. It is not complete until we verify the patient possess the psychological stability to adhere to that regimen, that they're actually going to be able to get the medication filled, take their medication, that their anxiety and their depression will not stop them from doing that. And that is something we don't think about all the time. What we must address is a secondary vector. And I want to move a little bit further into the substance use. What is the empirical correlation between chemical dependency and HIV transmission? Think about that. The data is unequivocal. Substance use acts as both a catalyst for new infection and coping mechanism for existing. I want you to think about that. I'm going to pause right there with everything that I just said. You're thinking, you're feeling that? Exactly. Stimulants specifically, and I want to say this in a way where you can understand that and come out with it. So when you're taking these medications, it drastically reduces behavior inhibitions, right? This leads to systematically higher rates of unprotected sexual encounters and needle sharing protocols. This chemical alters the risk assessment center to the brain. And you're probably thinking, okay, you just said a lot, and what sense does that make? What does that say in common, just in regular terms? It means that sometimes our mind can play tricks on us, keep us in this depressed mood, and we don't think it's worth it. We don't take our medication. We don't go to our doctors. We don't think it's worth it. And for those who are already diagnosed, what happens then? For those individuals that are already diagnosed, they are self-medicating. And you know what the self-medicating is, through alcohol to escape the stigma, or they just lock themselves away, or the fear. What are you thinking? Could that be you? Is that someone that you know? Make sure you tell them this is why we're here at Hope and Help and to listen to this podcast. I want to move a little bit further into treating the infection, the disease, without treating the addiction. What happens to that? Is it flawed? Absolutely. You cannot mandate a patient to prioritize their viral load if they're not actively navigating chemical withdrawal or psychological crisis. We must utilize an integrated harm reduction model. How can you focus on this when you can't focus on that? Think about it like that. Harm reduction is the pragmatic acknowledgement of reality. It means we meet the patient exactly where they are without moral judgment, no judgment at all. If a patient is unable and unwilling to cease substance use today, Our objective is to keep them alive and minimize the damage until they are ready. We had said this on many of our episodes. We are here to walk with you every step of the way. You're not alone. Now, this includes providing clean syringe access, testing strips, overdose reversal medications like Narcan. We secure the physical safety first, so we have the opportunity to treat the viral load second. Most importantly, you are not alone. I want to make sure that you're hearing that because I am going through this relatively fast. I want to make sure you hear that. Now, I want to detail the integrated model we use here at Hope and Help and how do we synthesize behavioral health with clinical medicine to repair this. You're probably thinking, what do you do? I want to make sure you listen. When a patient enters our facility, when you come through our door, our medical providers and behavioral health clinicians operate from a unified treatment plan. It's like the whole wraparound services. We do not demand to be sober immediately. That doesn't happen. We provide psychological evaluations, trauma-informed counseling, and substance use intervention concurrently. At the same time, we are working with you. We remove the silos. We do not deal with the stigma. We meet you where you are. The pharmacist, the physician, the case manager, the therapist, we are all working together for you. It requires immense operation coordination, and that's what we do best here at Hope and Help. It does not, but it's not the only methodology. It does work, but it's not the only methodology. This generates sustainable, long-term viral suppression. That's what I wanted to get to. The wraparound service piece provides sustainable, long-term viral suppression. One of the episodes we did where we actually did a formula for you, we said U equals U. You know what that means? Okay, I'm not going to tell you because I want you to go back, look at that podcast, and find out what U equals U. But it has something to do with long-term viral suppression. So I'll give you a little hint there. Okay, now let's move on. We've just talked about a comprehensive approach for this. And I think it is something that every single one of us or someone in our families or someone that we know can listen to. So it's been my privilege to take the time to walk you through such a difficult conversation, such difficult information to hear. But I want you to know that's why Hope and Help is here. For all of our listeners, if you are navigating a dual diagnosis or you know someone, a family or a friend that requires behavioral health support or seek harm reduction resources, I want you to contact Hope and Help. Contact us. You can go on our website. You can start at our website at hopeandhelp.org, or you can come to 4122 Metric Drive. We possess the integrated infrastructure to assist you. And I want to make sure that you know that. I'm Teresa Giles, and I will see you next time on the next HIV Real Talk, Real Solution episode. You don't want to miss it. And like I said before, make sure you go back and listen to this episode because it is important about the dual epidemic. If you're battling dual diagnosis, you want to know what you can do. If you are dealing with behavioral health, please reach out to us. That is something that we can do. If you find yourself that you don't want to take your medications or you don't even want to continue to come to the doctor, we will be there. We'll walk with you. You're not alone. So thank you again for watching us. Spread the word. Make sure you tell everyone about HIV Real Talk, Real Solutions.